Good evening, students from the PIDC. My name is Kim Lee. I'll be the host tonight for this webinar, live webinar from actually 3 locations. We're streaming from Penang. Obviously, you see Professor Talang there. We also have Dr. James Foster, who's streaming from the UK. And again, my name is Kim Lee, streaming from Hong Kong. So without further ado, I'll pass it over to Professor Talang.
Okay, thank you, Mr. Kim, and welcome dear students, faculty, and guests. It's indeed my pleasure to invite both Mr. Kim and Dr. James today for this webinar. It's the first one that we are doing since the movement control order has been in place since March, and as the restrictions are slowly getting relaxed, I think it's a good time to get back to routine. And when I received an email from Dr. James suggesting that he was open to have a webinar, I said to him that we would like to take this opportunity. And here we are, although it's 5 p.m. Usually 5 p.m. is when we close down the college, but today we are in different times. It's a new normal. So I think working from home and working remotely has its advantages and disadvantages. I'm sure all of you are seeing us. We are not able to see you, but I believe you are here with us. And with this, I think, thank you very much, Dr. James and Mr. Kim, for organizing this and having you over at PIDC virtually.
Right, man. Thank you, Professor. So allow me first to introduce James, Dr. James Foster. Very casual man, so he likes to be called James and not Dr. Foster. But Dr. James Foster is the head of dental services for Asia and Australasia for dental protection. He qualified from Newcastle Dental School in 1990. He was in general practice for about 16 years, in which during this time he had ran 2 practices in Northumberland. With various roles under his belt, he also was with the Northern Deanery in education, so he was an academic as well. Also working in clinical supervision with prosthodontics at Newcastle Dental Hospital. After that, James proceeded to do his master's degree in medical law in 2005 and have since obtained the MFGDP in UK, a certificate in clinical education. In 2004, he was appointed Dental Protection Associate, Dental Legal Advisor, and then became full-time Dental Legal Advisor since 2008, basically helping members around the world with any dental legal issues. He was also awarded in 2019 the Foundation Fellowship of Faculty of Forensics and Legal Medicine from the Royal College of Physicians. So without further ado, may I pass you over to Dr. James Foster. James, over to you.
Thanks, Kim. I do appreciate that. Thank you. And good evening, everyone. I'm sorry to be taking you through to your evening, but thank you very much for joining us. I had the pleasure with Kim meeting a few of you last November. And if I look slightly different to how I did then, that's simply because with our lockdown easing, I played a round of golf yesterday and forgot my sun cream. So I'm looking exceptionally pink today. So forgive the appearance and do not adjust your set. That's how I look. So I shall be more sensible next time. So it's my pleasure to talk to you today. We hope to be coming back to Malaysia in the future, but obviously for now, this is a good opportunity, and I hope you have some takeaway points that are helpful for you following this evening's seminar. Now, just very quickly, as Kim has said, I was in practice in the north of England, involved in the dental school teaching and training of first-year graduates. In the UK, there's a foundation training scheme. And with that background, I'd started some medical legal work and got involved with dental protection as an organization that basically is a non-profit organization with the ultimate aim of reducing risk to patients and protecting members. It's a comfortable place for me to be because I think we're a non-profit mutual organization with benefit to both patients and members, and it's a real privilege to be able to help members not only at a time of need, but hopefully at a time to try and give them the tools and the processes and the thought processes to avoid difficulties arising in the first place. So we do have, unfortunately, problems that arise when people are in practice. There are tens of thousands of patients who are treated every day, perhaps not so many the current time, but still tens of thousands of patients who are being treated and treated without problems. They're very happy with the service. The outcomes are all good, but occasionally problems will arise. And I want to put it in perspective. When we talk about some problems in this following hour, what I certainly don't want to do is for you guys to consider that the risk out there is huge. What am I doing? Am I going to face all of these challenges? May I be sued? May I be sent to the dental council? These things are very rare. And what we're trying to do is to highlight the problems that can arise, and in giving you the tools to adopt ways of avoiding problems escalating, you also at the same time build yourself a good reputation, you build a trusting relationship with your patients, and make you and your practice more successful. So it's simply not defensive dentistry. This is development of dentistry, development of your practice, development of your reputation. And I certainly hope that we're not going to make anyone feel uncomfortable. So I really need to make that point. You'll see some cases of extreme issues that arise. These are very, very rare. The vast majority is all good. And if you can develop the communication skills, confidence with your patients, the trust will be there for your success. So we are going to look at two elements: building your reputation and protecting it. Now, in terms of building your reputation, you've spent a huge amount of time investing in your education and to train and to achieve where you are headed and where you are now. Now, if we look at building your reputation when you then transform to practice, it's interesting when we look at those who are good communicators and those who are brilliant clinicians. They're often not the same people, and you may hear stories about, oh, Dr. So-and-so, he's a brilliant dentist. His hands, what a fantastic set of hands, but he just doesn't hit it off with the patients, or the patients just don't seem to like him. The converse is someone who's maybe considered fairly mediocre, but they have this great reputation around them. The patients love them. And it's not that the bad dentists are good communicators, or the good or the poor communicators aren't are brilliant dentists, but there's a combination. Sometimes the most perfect hands may not have the best personality, so that person needs to concentrate on their communication, and vice versa. So it is all about the communication. And when we're learning to develop and progress, we've got to first of all think, well, how do we develop? And learning is lifelong. Now, in your situation at the moment where you're about to start in your career, your exposure to the past is obviously very limited. The exposure to experience is very limited. But this is something that I would certainly recommend that you take on board, is that it is really important to reflect on experiences. And as part of the training for the first years in the UK, we used to have reflective learning tools and processes, and describe an element, what happened, what can we learn from it, what we do next time. Reflection helps develop. And taking feedback from patients, because you may not be aware what the patient's perception is, you may not be informed by the reception what the patients are feeding back. It's really important that we get that, because we are basically looking after a cohort of patients. And if they're delighted, great. And the things that you're doing that they really appreciate, great. If there's things you aren't, perhaps you need to know. Learning from colleagues, perhaps consider having a mentor, someone who you can rely on. People develop experience from legal cases. Legal cases will filter through to the front line, maybe a year or two after they are produced, but cases that might relate to consent, cases relating to claims in certain aspects of medical legal aspects. So keeping an eye on journals, keeping an eye up to date. Regulatory investigations, the unfortunate few who end up in front of the Medical Dental Council, it's publicized. It's helpful to keep an eye on what problems people are falling through, keeping an eye on what matters arise when there is a regulatory investigation. We produce a lot of cases and articles. If you go on our website, you can have a look at the experience of others and how to prevent those problems happening. And research, if you enroll in relevant scientific journals, you're going to keep up to date and generally sort of learning as you go through. That's just that little message. There's so much to learn out there as you go through. Now, in terms of building your reputation, I'd ask you to consider 5 main areas here. Now, the first is the small talk. And the small talk with patients, the relationship that you develop with the patients is huge. I'll talk a little bit more on the research about that in a moment, but that's certainly very significant. The consent process, and again, each of these topics you could talk about for many hours, but we've condensed them down. The consent process itself is very significant. You'll be aware of the principles of consent, and when we are looking at lots of colleagues, they say, well, I haven't got time to go through the consent process, write this all down. There are various ways that can be dealt with. Again, there was stuff on our website, and I will touch on it. But in terms of the consent process, one of the things that younger dentists often find is when they get into their first few months of practice, patients turn around and say, well, thank you for explaining that. That's very kind of you, and I understand it. No one's ever taken the time to explain that to me before. And you may see that on your own clinics at present. And that's building a reputation, that's building trust. And when that trust is there with the patient, that gives you a platform to protect you if and when things might go wrong further down the line. It builds your relationship, builds your trust, and a patient is likely to be more accepting if there's an adverse outcome down the line. That's the important medical legal element. The other aspect is they're going to be the people recommending your practice, singing the praises of your practice. Listening skills, I think perhaps in dental school, there's maybe a temptation to be focused on the tooth, not the patient. And when listening to a patient describing a pain, we may want to just hear the magic words to then make the diagnosis and say, right, got it, jump in. Whereas really perhaps it's better to try and let the patient tell the story. I think there's some research that suggests dentists tend to listen to patients for about between 7 and 8 seconds. That's old research now, but it always made me laugh, just between 7 and 8 seconds before they dive in and stop them. We need to just perhaps bear in mind, let the patient communicate better with us. Competency, obviously we have to keep up to speed with our competency. Be conscious of what we're trying to achieve, because there's temptation to jump into the complex stuff as soon as the graduation's occurred, whereas I liken it a bit to a driving license. You need to be building slowly the depth and knowledge and skills to build a platform upon which you can then further train to the more complex stuff. And we see people that ignore that and go straight into complex stuff. They're the ones that end up with some significant problems. So please bear that in mind. And the records, maintaining records is really important. I mean, patient safety, say if you're working in a clinic where other people are there, or you're working part-time, patients are coming in and other dentists may be picking up the records. They want to see what's been done, what's planned to be done, why it's been done, where the patient is on this. That maintains patient continuity, really important. If there's a challenge, then lawyers and dental counsels are going to look at the records. And if you're trying to protect your reputation, you want to make sure that it's all in there. And certainly the big thing about reputation is, should you ever have a challenge, and God forbid you do, but if you ever have a challenge, a complaint to the dental counsel or a legal case, if anyone is perceived to have rewritten the records, effectively forged the records, then the incident isn't then about a fractured file, a paresthesia, whatever the patient was happened to the patient. It's about the dishonesty, and the dental counsel cannot see a remediation process for dishonesty. If there's a problem with a type of treatment, then often there can be a remediation consideration through mitigation, but dishonesty is totally different. So please bear that very much in mind. Now back to the small stuff at the beginning of that list. We talked about how it's important, and there's a lot of research that I'll just touch on very briefly, but the message is, this was some research in the States about obstetricians had never been sued, and the most significant characteristics between the two groups who'd been sued and those who hadn't was not the treatment itself, but the way in which it was provided. It's the way in which you're dealing with your patients. And this is really an important message that just carries weight everywhere in terms of when a patient is likely to make a complaint and when do they. So we might think, well, a patient's bound to complain if there's an unsatisfactory outcome, if I've caught the lip or the floor of the mouth with the drill, there hasn't been sufficient care, they've had problems as a result, we've done the wrong thing, made an error, or the system's errors there, the denture's addition's been done wrongly, the denture's not back, or they've double booked an appointment. Those are the sort of things that, right, that person's going to make a complaint. Whereas in fact, that's not the case. All the research says there's lots of that goes on all the time, but only a small proportion of people actually complain. And which proportion is it? Well, it's the proportion that have been predisposed. Now, if your patients, things do go wrong, that's going to happen. So if you look at the precipitating factor column there, those things unfortunately will happen. We can put systems and processes and practices and audit our way that we do stuff, keep ourselves competent to reduce them, but they're going to happen. And when they happen with the group that are predisposed, now they're the group that perceive the practice to be a bit rude, they're not bothered, they abandon them if there's a problem, they don't look after them. They're the ones that are going to be agitated into action. And it's making sure that you look after the patients, develop trust with the patients, so when things go wrong, they are accepting, more likely to be accepting of it. If it's throughout life, this, not just in the dental surgery, but if somebody has offset you, they've put you on, you're sensitized already, and then something happens, you're more driven to challenge them, and it's exactly what happens here. So further on that research, characteristics of the clinicians who were most frequently sued as described by the patients, so this is in the patient's words, we're talking about those that were rushed, disinterested, disengaged, weren't bothered, lack of concern that I was in pain, not even listening to me when I was trying to explain I was unhappy, and just fobbed me off very quickly. Other comments, self-obsessed, a little bit arrogant. Now, it's worth bearing in mind one common theme that sometimes we see with younger practitioners. If a patient comes back to the practice unhappy and is maybe being a bit vocal in the waiting room, being a bit angry, a young practitioner might think, goodness me, I don't want a confrontation in the waiting room, I don't want a confrontation here, I don't feel comfortable, just tell the patient I'm busy with another patient. Now that is a dentist who's unfortunately not used to confrontation and doesn't want to face at that moment. The perception from the patient is too arrogant to see me, not concerned, and it escalates, whereas the two sides actually were standing in different places. So bear that sort of thing in mind as we go forward. Disrespectful or dismissive, rude or ill-tempered, whatever's going on at home, or if there are issues, you can't really bring them into work if you're having a bad day, easier said than done sometimes. Preoccupied with technology or equipment, we tend to be very focused on our new machines, distracted, not concentrating, more interested in the dentistry than the person. So one of the top tips about reputation is you treat the patient, you treat the person, not the tooth. Impatient, and those that say, nothing's ever off my fault, nothing is my fault, it's always put back to the patient. So if a patient is blamed for the failure of a treatment, that's a real driver for them to say, hang on a minute, I'm not having this, I'm going to take this further. Now, in terms of competency, there's a professional requirement really to maintain your basic standards, obviously, keep up to date in your chosen field of expertise, acquiring and developing new skills. When things don't go to plan, the essence is to have the knowledge, experience and training to know that something is not quite right, and the integrity to discuss it with the patient. You've got to be open and honest, sit the patient up, explain what has happened, and know when you're getting out of your depth. It's the old expression about if you're in a hole and you keep digging, that's when people get into real trouble. And unfortunately, those are the situations where we tend to see colleagues when they're then challenged. And in terms of competency, we're seeing, as I just mentioned before, some people ignoring the depth and breadth of learning practice and then going on to further training. And a classic is short-term orthodontics, that's what we call it, or the aligner type orthodontics. And here's a classic from an online dental forum. One one of our younger colleagues has just put on a quote saying, this patient has advised he would need surgery, but he doesn't want it. He'd like to have a brace on his top teeth. I would welcome any advice how to carry out orthodontic treatment. So here we have an incredibly complicated, difficult orthodontic treatment that was proposed orthognathic surgery, and a young dentist is saying, can anyone tell me how to treat this patient? So it's that sort of approach that really would cause concern. So in terms of protecting the reputation, I mentioned adverse outcomes, and we'll look at professional challenges that may arise. Now, adverse outcomes, this effectively, we're looking at what can go wrong. And just to make the point, we are human here, and these things are fairly rare, but there are some areas, some certain patterns that we could look at. Clinical area where there's shortfallings in training and competence. Time and again, perhaps short-term orthodontics being a real example of that, is poor case selection, poor assessment. We do see a lot of those cases, and maybe someone as a youngster has been unsuccessful with fixed appliances, and suddenly at 30 they want some new treatment, and people are diving in without the training, without doing a full assessment, and it's going wrong. Human error will occur. The consent process, if valid consent is not obtained, then there is a vulnerability in that the patient or their client, their legal representation, should they be seeking it, would argue that had they been aware that X, Y, and Z could happen, then they wouldn't have had it in the first place. So there's an element through the consent process. If valid consent is not there, a successful claim in negligence can arise, and I'll touch on that later. If a patient's expectations are not met, then there's going to be dissatisfaction, inevitable. So it's really a significant point to bear in mind. What is the patient's expectations? Because if you're not going to reach it, you're going to have a disappointed patient, which could lead to problems. And communication issues, a lot of cases that we see, in fact, the vast majority have an element of communication issues, whether there has been a lack of communication, whether there's been a confrontation, whether there's been a reaction to a patient's aggression. So please bear in mind that we're not on a level playing field. If a patient challenges us and we challenge them back, fight or flight kicks in, then the patient doesn't have a dental counsel monitoring their actions with ethical obligations, but we do, and we need to bear that in mind should we be challenged. So let's have a little look at what may go wrong, some of the bigger cases that we see. Do bear in mind what I said at the beginning. These are very rare, and please don't be overly concerned, but let's just see what we are seeing. Start with implants, because they're a big one at the moment, and unfortunately when we do see implants being impinging on nerves, we do get some significant claims coming through. So you can get a neuropraxia. Look at the inferior dental nerve. The canal here has been breached, use of an oversized implant, and patients can get a neuropraxia, so they have the paresthesia with a debilitating sharp pain, and often that can lead to psychiatric element to the damages being claimed in litigation. Certainly a couple of spectacular cases in Australia where there was a subsequent depression, subsequent loss of job, collapse of marriage, business, etc. And these can be enormous claims. Some people, when they have nerve damage, react differently to others. Some it's not so bad, some it can be really significant. So this is a preventable situation in the majority of these. It's just assessment and planning, using stents, using CBCT, using what tools are available to make sure we minimize the risk of this happening. So this is something that we do see, unfortunately, cases in. We also see cases with paresthesia from wisdom teeth. Now here, unfortunately for the poor patient, we've got 2-2 that's gone up into the sinus, but that was not the major issue here. It was the fact that when 4-8 was removed, there was a crush injury on the IDN, and we've got a paresthesia as well. So nerve damage through the extraction of wisdom teeth is something we do see. So we've got implants, nerve damage, wisdom teeth, nerve damage, and the third big ticket at the moment is problems with these short-term orthodontic courses. There's a push to get the upper front 6 straight, but of course that can lead to occlusal issues. And here's a sort of classic situation. You get nice straight front 6 teeth, but patient spitting, there's a disruption to the occlusion. You'll have an overjet, an overbite, anterior open bite perhaps, or posterior open bite. And it's gone down a path that needs rectification. Now, of course, the remedial treatment and subsequent damages may not be as anything like a neuropraxia nerve damage case, but they're still significant because we do see quite a lot of these, and really would emphasize the need for substantial training and understanding before people dive into this. This was a clear aligner case with a lateral open bite. It was a general dental practitioner with no aligner experience, following advice from the laboratory, and ended up with a dental counsel as well as a case for negligence. So just a word of warning on the new treatments that come in. People sometimes jump in, see an opportunity and jump in without full understanding of the situation. So please, I would urge all to be careful on that. We see some clinical situations arise out of error. Unfortunate mistakes arise, and this is one. And as we've perhaps seen before in November, if these days you're using sodium hypochlorite, which we didn't use when I was qualifying, it's very effective for root canal treatment, but if it's into the tissues, can have a spectacular result. We do see the odd case where there's hot instruments used. Those are rare. Far more common perhaps is the situation where we see things like fractured files. Now, the fracture of a file, unfortunately, is something that may very well happen. And if we say to a patient afterwards, just a quick point, if we say to a patient afterwards, oh, it's a known risk, then the patient will say, well, if it's a known risk, why didn't you tell me? So these sort of things you can preempt by discussing prior warning to the patient. Other issues that we sometimes come across, there's quite a few cases of this in the UK under a sort of NHS, if you like, capitation scheme. So it's keeping regular care of a patient under a scheme. And if we don't take care of the periodontal problems, this can run its course. Patient changes to go to another practitioner, and the new practitioner says, well, who's been looking after your periodontal problem? And then there's a case can arise there because people of both sides, the long-term dentist and the patient, have not really grasped it, and they've just let it drift, and then a new person in makes comment, and there's trouble. Bits of roots left, that happens, and unfortunately others can be involved because you might see your principal's patient with a dry socket. If the records say the tooth's been removed in its entirety, you would believe it. Perhaps look to your senior colleague and think that was right, but if it hasn't, and you continue to treat it as a dry socket, and then the patient then goes to another practitioner, the problem is. So just the word of advice in that one is just make sure when you see a patient, it's your responsibility. Perhaps you may not need to rely on the word of others to protect yourself. Make sure you look at it, assess it individually in your own right. So in terms of the adverse outcomes, when are we most at risk of these occurring? And these are very much the case. The emergency situation, when you're perhaps not seeing a patient you've seen before, they're in pain, they're perhaps frustrated, there may be a lack of sleep, perhaps you're seeing them out of hours, you haven't got your usual equipment, or you're rushed, and patient pushed into the middle, and that's a really tense situation. Patient who's fear and anxious, or perhaps yourself being in fear and anxiety in relation to a domineering patient. Difficult interactions. We're not used to conflict. Some people are. Lawyers, lawyers deal with conflict all the time, and they react very differently to perhaps a healthcare worker who's challenged, because we're not used to it. So if the adrenaline starts running when someone is having a go at us, how do we react? We're not in our comfort zone, and things can be said, and that can lead to problems. Time limited decisions, got to be careful about. Obviously our day book, but not to rush or be seen to rush. And I would say owning the appointment book. You need to be in charge of your appointment book so that patients aren't put in at inappropriate times, or you haven't got 3 or 4 molar endodontics in a row on a Friday afternoon. You've got more balanced book. And I like this one, HALT. What do we mean by HALT? Well, we're talking about when you are hungry, angry, you're late, and you're tired. Okay, so remember that halt. That's a time when you could be compromised. And just back to the appointment book, about owning the appointment book. If you have a look at stress and performance, it's a slightly lateral point that I'm making here, but if you are, a certain amount of stress is good for you. When are you engaged? When are you best? I prefer to be working, say, mid-morning. And when I was in my practice, that was probably when I was best to do complicated stuff. 5 o'clock in the afternoon after a full day, I don't want to be doing something really precise. Now, other people are the other way around. So make sure you own your appointment book to put the complex stuff in when you feel more comfortable doing it, and don't let the appointment book determine otherwise. Learning from other industries. Now, SOPs is a common expression now, particularly with the situation we have, the standard operating procedures. You know, does the practice have those? So many other industries do. Ours are now coming in through the COVID response, and should be adopted and stuck to. Simulation, yes, we do CPR simulation. Do we do simulation for problems with appointments, emergencies, patients unhappy? Who's going to take control of that situation? Who's going to respond? So simulation can be helpful. A sterile cockpit is a good one. Associate of mine in Northumberland, when we were working, he always had the radio on full tilt, very loud. He said some patients liked it. I'm not so sure. If you've got a talk show or a radio going on in the background, I'm not so sure that isn't a distraction. And I know that the airline industry share that view, in that there's no talk under 10,000 feet when they're either taking off or landing that's not related to what they're doing. They're keeping it sterile. And I think when you've got complicated stuff, or certainly you're concentrating on, you might want to be shutting the door and turning the radio off and focusing. Everyone's different, but worth bearing in mind that sterile cockpit concept. Right information at the right time, your records available, medical history available, making sure the team are aware, they're telling you what's happening at reception, and situational awareness of the team. Now, just move on to the team. Really important to make sure that whilst you are the practitioner and you're looking to build your reputation and protect it, that reputation can be enhanced or challenged by the team around you, depending how that team are working with you and with the patient. So just quickly touch on that. We're looking at the practice environment. If you've got a welcoming reception, they're attentive, they're responsive, empathetic, make the patient feel welcome, make the patient feel special and looked after, that team's going to reduce the risk. They're going to limit the escalation of any dissatisfaction because they're there to help and support, and they're going to help build your reputation. We talk about ways of advertising the practice. It's word of mouth. It's word of mouth. People who have been bowled over by the experience, enjoyed the team as one, not just the dentist or the angle on a restoration or the margin on a posterior crown. It's the experience, and this is so important to have that team in the practice working as a supportive team. Then in the surgery, if you've got a dental nurse that's chairside with you, if you've got a really good chairside nurse, that's invaluable. Having a good nurse who you have a good relationship with, who you can work well with, who thinks ahead of you, is really, really important. And someone in that position can take the lead in patient management. They might see a patient's upset and just take over, or they might see that a patient has got another issue going on, or patients continually looking at their watch. They might say, look, is there an issue? Patients often give off signals that we might miss because we're concentrating on other stuff. And if you've got a good assistant, perhaps they can intervene if we give them the go ahead to do so, if they feel confident in doing so. And I think there's an argument and a discussion to be had about that, is how much do you let your nurse intervene? And you should be allowing it. If you've got the forceps on the wrong tooth, allow them to feel empowered to have a word and stop you. So another thing, a good observant assistant, if there's a latch is loose, you could avoid inhaling a burr. We might be looking in the mouth. The patient actually may be looking clammy and a bit green and sweaty, and they're going to notice that and it'll alert you. If we are looking elsewhere in the mouth and they're aspirating and they might see an ulcer on the tongue, obviously that's significant. Spot analogy on the medical history form that we may not have seen. They may pick up whether a patient is someone who's taken alcohol or taken drugs and alert us to that. because there's consent issues over that, and taking appropriate notes. If you are having a conversation with a patient about procedure and there's a long discussion going on, having your nurse just trace that into the records is perfectly reasonable. You're responsible for what is in there, so you check it afterwards, but they're very good, experienced clinical nurses are very good at picking up the relevant points for conversation and jotting it down. And it's something as a concept we don't tend to engage in or think is relevant, but it really is. And I think I would urge to look at that. You're responsible for it, but doesn't mean they can't enter it. And a real asset, so they know what we're going to do before, recognize when something's gone wrong. As I've said, it's not that tooth, and a further conduit towards between, forgive me, the patient and the dentist, and it's all part of patient support. Now, if they're not performing and the chairside team are not working as they should, then you could have cross-infection lapses, which is obviously of huge importance at the current time. Wrong patient called, we do see that. Lab work missing, stock out of date, poor maintenance, and these things that are bad for reputation, which falls to the clinician. Vital signs being missed, verbal and clinical from patients, and complaint in the making not recognized. So it's really important to have a good working team. Into the reception area, if you've got a good receptionist who's positive, friendly, welcoming, very professional, doesn't treat the patient badly, treats the patient welcomely and is there for them, then again, the experience is good. If you've got a receptionist who on the front is not performing, and I've certainly come across this in my own practice, phone is more important, pushes the patient away, not very happy, tells the patients off when they're 2 minutes late for their appointment and doesn't accommodate, won't bend over to try and push in, then the patient comes through to the surgery not very happy, and it can reflect. So if reception isn't going well, the patient can get the wrong message from the start, and the start of the journey is not good, and they're already getting pre-sensitized. They may be predisposed, looking for problems. So might be late running. If you're running late, every receptionist should be saying, look, Dr. Foster's running a little bit late. Do you want to rebook? Are you okay? And keep them informed. There's nothing worse than sitting there and no one's saying anything, and it's 20 minutes past your appointment time. It's half an hour and no one said a word. That patient's getting very predisposed and angry. Double booked, problems with appointments, days being cancelled. This sort of stuff is really detrimental to the reputation of the practice and the practitioner. Arguments about money and bills left unpaid. You need to be concise, and they need to be doing that appropriately, because when these things all add up together, you've got a patient who's looking for faults, looking for situation, they're predisposed. Okay. Now, moving on to what follows from an adverse outcome. We saw some examples of adverse outcomes there, and how we're going to manage those. So if something goes wrong, patients want good communication. They want to feel supported. They want a meaningful apology. Now, an apology is not an admission of liability. If you're saying to somebody, I'm sorry that you've had a problem, you can word that to be meaning either way. Here, I'm sorry that you've experienced a lot of pain after the extraction, is not saying I caused it. Whereas I'm sorry I took out the wrong tooth clearly is. Both instances, the word sorry is there. Now, for the second one, if you've taken out the wrong tooth, we've heard people say, oh, I couldn't possibly say that I'd done something, liability, I couldn't possibly. Please ignore anyone who's pushing people not to say liability, because we have a obligation, duty of candor to the dental council and our professional and ethical obligations to be open and honest with our patients. And if you make a mistake, we need to be upfront. If we are perceived to be trying to hide that and bury it away, then that's when a patient or family will come shooting back with the element of you being disingenuous. So if there's a genuine problem, a genuine error, saying sorry, please look at this. Saying sorry can make all the difference. So apologizing can avoid and resolve complaints. And this is lower level. If you're saying, I'm sorry you've had pain, that again is helpful when somebody has had pain. If there's been an absolute problem in terms of the wrong treatment, again, be open and honest, and patients are likely to be more accepting than those that perceive you've tried to hide it. Now, an apology and explanation can provide reassurance to a patient, and it may be that that's all they're looking for, and it's not going to land you into difficulty with a claim. There's been a court case in Asia recently that established that. So the regulators increasingly require people to be open and empathetic in their responses, an in-depth analysis, and a commitment to fix problems. So if we have a problem, we need to consider if it looks like it may escalate, if there's been a significant error, could this be something that might escalate to a dental council complaint? And if it did so, how would it look at the time? And what have we done after? So for example, if there has been an error where there's been significant injury, what do the records look like? How was the patient dealt with? Was there appropriate onward referral? Was there a review? Was there follow-up? And was there a duty of candor? Was there open disclosure, transparency, and apologies? So please bear that in mind. And there's other elements of this as well. So if we are open and honest with our patients about any unfortunate incidents, adverse outcomes, it helps the patient and indeed yourself recover psychologically. So if there's a significant problem, being open and honest and talking about it, resolving it, helps both parties. If it's left, if it is left unaddressed, it's not good for either party. And if it goes to a legal claim, unfortunately, same again, that's an adversarial process. So if you can get in there and be open and honest after an adverse outcome, there's a lot to suggest that this will influence the patient's decision whether or not to take it further. So a lot of research, does effective communication influence the risk of patient action after an adverse outcome? And if you look at those comments there, it's all positive. If you've got good communication with your patient after an adverse outcome, you significantly reduce the risk of them either seeking a claim against you or going to a dental council. Please remember that, okay? Don't try and hide it away. Be open and honest, follow up, and take the appropriate steps. And if necessary, please contact, if you have an indemnity organization, if it's us, please get in touch with us, because this is what we do. We'll help you through the process to try and resolve. Now, which patients take action? If you remember my comments earlier on about the experience of patients, this backs up the research that was done in America. So the patients that go further are the ones that consider there's been poor communication, devalued, not taken seriously, and deserted. And certainly in claims, the patients that feel they've been deserted are very much the ones that go forward and take action further. And when they're taking action, what do they want? Well, they want to know what happened and why. Patient, for example, has had a wisdom tooth out and they got paresthesia, and it's a significant significant problem for them. So they want to know what's happened and why. They want somebody to acknowledge responsibility. They want accountability. And if something has happened which shouldn't have done, some patients say, right, I want to make sure this doesn't happen again. And you might see that with a misdiagnosis of an oral carcinoma. They might say, look, we don't want family to go through this again, and they'll push down that route. And of course, financial compensation. If, my wife was taking legal action against a practitioner because I'd had an oral carcinoma, my earnings over the next 10 years obviously weren't going to happen, then you can understand that people are going to be going down that route. So, professional challenges that may arise. Now, these are rare, and I don't want you to consider these in too much detail or to become a little alarmed at the prospect. Again, these are very low incidences that reach dental council, low incidents that end up in a claim. People will complain, always going to happen, I'm afraid, but how you manage those and how you react and the pre-existing relationship with your patients is all significant in terms of the eventual outcomes. The challenges can come from patients, naturally, parents of patients, or indeed siblings, colleagues and staff. So in terms of protecting your reputation and building it, you've got to consider all elements of your professional career and your professional contacts. Now, when we talk about challenges, there are some interlinks. You tend to see claims tend to be separate to dental councils because a claim is for a different purpose. But we'll just quickly touch through these. Patient generally tends to complain to the practice. They'll set out what they want, and if they haven't set out what they want, we should do it. We should ask them, how would you see this resolved? It's often something that doesn't happen because we think, well, what can we do to sort this out? Have a chat with the patient, perhaps even get them back to the practice and ask, what is it that we can do to resolve? And hopefully it's resolved at the practice, because if it escalates elsewhere, that could be when it's become a claim or a dental council. So if you can resolve it in the practice, that's where you should focus on, trying to keep it in-house. And I would just refer you to the Dental Protection Malaysia page or Malaysia website. Each country's got its own specific website. And in terms of advice booklets, we have this comprehensive on handling complaints. And it's worth bearing in mind when you're in your practice, how is the team positioned to take a complaint, how to identify early. You're encouraging feedback. You need to take it seriously, and then be there, seek advice from us, because we're there to help if things progress, or you just need help in the first instance. The dental council, patient will complain directly to the dental council. It's seen as an easy way of getting almost a challenge back to the dentist. This tends to be the personal driven ones, not after money, after a challenging to the practitioner when relationships have really fallen apart. Patients tend to want some sort of action against the practitioner in those situations. And obviously there's a whole process that goes through that the council run. And in order to protect yourself, you need to be very much aware of the content of this document. Okay, the code of professional conduct is the rules of the game, if you forgive the expression. Those are the rules you will be held against, and any action that results in a complaint being made against you, the detail of that complaint and your actions will be measured against this. And if you've fallen short, and unfortunately there may be a finding of found guilty of a charge, so please fully understand what there is there. All of that information is available. Look through the council website, keep up to date with any amendments, keep up to date with the rules, and keep yourself safe. We work in Malaysia with two panel lawyers, Shernan Dallimore and Raja Darlan Low, and Eileen Raja was with us in November doing some lectures, and this is one of her slides, and I just like it because it sums it up. People get very challenged if they get a dental council complaint, and naturally stressful, and can be a time at which people prefer to bury their head in the sand rather than just grasp the nettle and deal with it. Now, unfortunately, it's not going to go away. If it started, it's not going to disappear. So you need to grasp the nettle and deal with it. Whilst that's going on as well, I would say, because we're here to help through that process, we use panel, we use the dentist in the UK like myself, and we have a legal team back here as well to assist the legal team out there. So when we look at situations, the stress and anxiety of having a challenge can be an awful lot to bear. We do have a counselling service for colleagues. Mental health is very important, and it's a very difficult time at the moment. So do bear in mind there's a counselling service available for members who feel challenged in such a process. In terms of a claim, the patient is basically seeking money, and they're going to a lawyer, and it's all about finances, really. We mentioned the principles before, but when it boils down to the bottom element, there's a financial element to this. And how do they be successful in a claim? Well, I'm sure perhaps as you've touched on before, duty of care. Well, dental patients, it's quite easy for that duty of care to be demonstrated, that there's been a breach of that duty and that harm has flowed. So breach of that duty and harm has flowed. So it's all very well saying, well, you did something wrong, but if there's no harm, then there can't be a successful claim, and vice versa. What I would just add is it is relevant in terms of consent, because if we look at consent, okay, there's no consent to have any treatment, then that's tort of trespass. So that's actually, that is assault and battery. But if we're looking more realistically at where it's relevant to dentistry, is that if we don't obtain valid consent, then there's an element that the lawyer acting for the patient can focus on and can be successful in a claim. So, for example, if I've taken out a lower wisdom tooth and the patient's got paresthesia, But my assessment, my training, my technique, everything about that has drawn positive comments from the experts' opinions that were looking at the case, and there's nothing to be found at fault with what I've done. Then the plaintiff's lawyer can say, okay, well, the procedure itself, the dentistry was fine, but my client says they wouldn't have had the tooth out had they known that this could have arisen. So if a material risk is not explored and not explained, then that's tort of negligence because there's been an invalid consent process. So we see lawyers now not necessarily challenging on the nuts and bolts of the dentistry. They can get home on the consent process by arguing, had I known this would have happened, my client would have refused the treatment. So we need to bear that in mind. So in terms of reputation, please bear in mind these summary comments. Professional approach in all things, and that's both in and out of the surgery, both with your practice, your team, your competence, your understanding, your reading, professional approach in all things. If a complaint comes in, please don't ignore it, because it may not go away, and it may actually develop. If you don't deal with it, it could escalate to others. Whereas if you've got an opportunity to deal with it in-house, that's going to be far more to your benefit. Effective communications, whether that's with your laboratory, colleagues, referrals, your team in the surgery, and of course your patients. It's all round effective communications to the whole teams, colleagues, and patients. If you are challenged, avoid fight or flight. As I said before, we're not used to conflict. As healthcare workers, we're there to help people. It's innate in us. That's why we've gone into this profession, because we like to assist and help patients. So when we're challenged, and these things tend to be quite rare, our heart's pumping, as I said before, adrenaline's running, hands are sweaty, and we're not used to that situation. Please take time to just respond gently, slowly, at a different time, maybe get the patient back for an appointment. Tend not to react to it, because if there's a finger wagging patient shouting at a colleague and the same comes back, the patient will say, right, I'm off to somebody, and that somebody could be the dental counsel or a lawyer. So try not to respond, because you can pour petrol on the situation if the adrenaline is pumping. Properly documented at the time. Keep records, particularly if there's something, when you're seeing patients. I talked before about experience. Now, sometimes experience will make you think there's something quite not right here, and I'm just going to keep some extra records of what's going on here. Or there's an event happens, and you make sure that your records are very comprehensive. If there's been something, a patient's reported a paresthesia or a patient's reported a problem, make sure your records, even if a phone call in, are very comprehensive in that. If there is a challenge, it's the records that will be viewed at by lawyers or dental counsels. And as a team, including yourself, avoid predisposing patients. We talked about how an effective team could look after patients, whether it's at reception or whether it's in the surgery, whether it's chairside next to you. And I'll just finish with a case that unfortunately is so predictable, but it does happen. Here we have a wisdom tooth to be extracted. Now, I certainly would not have attempted this myself, because if you look at the 4-4, we've clearly got a big issue in terms of the morphology, its position and proximity to the PIDC. So unfortunately, the top half of the tooth was taken out, leaving the lower, and that was it. There was no follow-up. Now, the patient had lots of problems afterwards, and a complaint came in. And I'll just whiz through this. So a formal complaint regarding professional misconduct around the extraction of wisdom tooth. That terminology to me, that this is a lawyer or someone they know legal speaking through it. Arrived at the practice, a routine procedure to extract a wisdom tooth. Well, it certainly wasn't routine. Looking at that, should have been referred. Initial X-ray confirms there was a problem with the wisdom tooth. Injection taken out, various instruments. You've got strong teeth. Blaming the patient there. You continue to use other instruments, and then injectomy, more anesthetic. After the 4th, you started drilling, so drilling down, trying to section. You respond to saying it's too late to stop and had to continue, so you're digging down deeper and deeper. You're in a hole and you're digging further down. Persisted drilling for a long time, eventually stopped when you got to gum level and said, couldn't drill anymore. You're afraid you might damage the nerve at this stage. Asked for a second X-ray, which is attached. X-ray showed you only removed the top of the tooth, but significant amount below. You advised that the tooth below the gum would either grow in, the event of which I should come back for you to cut more of it. Alternatively, you advised that my body would absorb the rest of the tooth. Medically, both do not occur. So you've got, unfortunately, a situation there where the patient has had an adverse outcome, they haven't been looked after, and they feel they've been spoken to inappropriately with a very disingenuous comment at the end there, and that's a driver, and it stands out, and it's just a classic example, unfortunately, of how people can inadvertently land themselves in great difficulty. And I hope that is helpful in terms of some points to take on there. One last thing, in terms of who looks after the practitioners, you're a healthcare professional, you may be working long hours, invested an awful lot of time, achieved an awful lot to get where you are. Would say mental health is very important, obviously. Physical health is as well. You've only got one spine, and dental surgery is not the ideal setting for spines. Please consider buying loupes. It's an investment worth having. And get your work-life balance and your finances correct. It's a long haul. It's a marathon, not a sprint. Say when you qualify, get your work-life balance right, and I wish you all the very best in your future careers. I hope there's been some helpful points in there. Do bear in mind that dental protection is there to help. We have Kim, who's obviously with me, and Julia. Kim is based in Hong Kong, and Julia in Singapore. And there's a team, so there's a team on the ground in Asia to help and support. I would refer you to our online material and our website. We have a whole PRISM platform for members to pursue, and Kim will follow up on that. But there is information there. Please use it. It is helpful. And I hope that has been of some help to you. I shall now stop sharing my screen, Kim. And over to you.
Thank you, James. Let me first, before we end with some final words, let me just show a brief video about dental protection. It's only going to be about a minute or so long.
In today's ever-changing world, as healthcare professionals, you're under more pressure than ever before. You need to be there for your patients, so know that we'll be there for you, as a genuine partner in your career. We truly believe that prevention is better than cure, so we aim to be much more than a last line of defense. At the beginning of your career, passing exams is the most important thing in your life. So with revision guides, discounts on textbooks, practice exam questions and more, support starts now. With members in countries around the world, wherever your career takes you at elective time or following graduation, you can rely on hassle-free support and expert knowledge. As a doctor, dentist, GP or general surgeon, whatever your path, MPS is with you at every step. Benefit from risk management workshops, online learning and publications, all designed to help you prevent the worst from happening. And if you need advice, our team of medico and dento legal advisors are only a phone call away. With these resources, our 120 years experience is yours. But even the most experienced clinicians can find themselves on the receiving end of a complaint or claim. And when that happens, our expert team is here with world-class defense and more. We can handle the media, offer counseling services, and provide support to get you back to your best as quickly as possible. Advice, support, education, protection. That's why 97% of our members make yes.
So welcome back. So some final words. We are very delighted to have had this session with yourselves. And I think what we would like to do in the future is to engage with you more. Hopefully, when we have a chance to travel once again, we'll be able to come back to Penang to engage with all students and the professors within the Penang International Dental College. But before we do depart, I would like to also showcase to you that we have got an opportunity to because normally when we're out and about, we would actually bring some goodies, bring some incentives to engage with yourselves, whether it's power banks or things like that. Unfortunately, we're not able to do so on this occasion. So what we would like you to do, if you could bring out your phones and scan the QR code that you see on the screen, and we'll be able to raffle off some vouchers, which I believe the easiest way right now is with Grab vouchers. So amidst COVID-19 and the MCO, this is the best we can actually do. So if you could bring out your phones, and if you scan the QR codes, it would actually allow you then to provide us with your details. And from that, we will be able to do a raffle to issue out some vouchers from Grab. So this actually ends our presentation, and we hope to see you all again soon. In the meantime, if you are keen on having more information, we do have a lot of publications, as James had mentioned earlier, which actually helps you on your journey moving forward. So here's the website, easily found. If you can't type in the whole sentence, all you need to do is go to www.dentalprotection.org, and then that will take you to our main page where you can actually navigate and find some case studies and some actual publications and resources at your fingertips. So with that in mind, I shall thank James again for his presentation. I thank Professor Telang for his time and obviously organizing this with the students. And I sincerely hope that everyone stay safe, and we hope to see you again once the COVID-19 issue has been brought to order. So once again, have a good night. Bye.